Now, all morning we've been following Camby's Golchin here and with Aideen, who has been working on, and they're based out in the Beacon Clinic, and basically what we've been doing is we've been calling it ironing your face treatment. It's a non-surgical facelift, basically that's what it is. And good morning to you.
Good morning,
How are
Alan.
you? And Aideen's working, she's fine, she's relaxed there. We'll talk to her maybe in a couple of moments about how she's feeling, but tell us about this treatment. What's it called? We're calling it face ironing, but it's obviously not that.
It's not, Alan. This is called Pellevé. It's in
Pellevé.
Pellevé, which literally translated means skin lifting.
Right.
And basically this is a non-surgical, non-invasive way of tightening skin.
Right, okay.
It comes from America. It's FDA approved, so we know it's safe. And essentially it's a safe, simple, very easy, no pain, no anesthetic, no downtime way of lifting the skin.
Okay, now so you started earlier on because it takes, how long does it take? How long does the treatment take? A little over an hour?
For full face, you're talking about 30 to 40 minutes.
Oh, is that all? All right, okay. So what are you doing here? You're putting the gels on first, is it?
We basically put a gel on. This is a little bit like the ultrasound gel that most women would be familiar with when they go to have a scan for babies. And then the treatment is done using this little magic wand.
Okay, so the gel goes on first, so that covers the face totally. And there, now we see the magic wand. Now, what's the other thing here? Is that just to?
That's a temperature probe.
Right.
It measures the temperature of the skin, because the way this treatment works, this is a radio frequency treatment.
Okay, you can see the little lights there. That's to keep the temperature under control.
Basically, we want to get the skin to what we call a therapeutic temperature. At that temperature, we get the effect of this treatment.
Right,
which
so
is,
you bring it up to a certain temperature.
We do indeed.
All right,
yeah.
Okay. So what actually happens? What is this and what's going into?
Okay.
Is it radio waves?
Radio frequency.
Radio frequency.
So all it does.
So why does that do? Why does that make the skin look better and decrease the wrinkles?
Well, basically what happens is that the radio frequency passes energy to the skin, and as it heats up the skin to that temperature, which is not too hot, we're talking about 38 to 39 degrees.
So, Aideen, were you feeling it very hot?
No, not at all. It's just a warm sensation.
A warm sensation on your skin. Oh,
It's more like a warm massage.
Oh, okay. So a nice facial, getting a nice facial.
Exactly.
Right.
At that temperature, the collagen in the skin basically contracts and shrinks. And body's way of responding to that is to produce new collagen, and that happens over weeks to months later. So the effect of the treatment continues.
Okay.
The study that was done in America to pass this treatment through the FDA, 90% of people saw improvement 6 months later.
So show us there what you're doing then again. So basically, are you concentrating then on, so if somebody maybe has a bad line in their forehead or lines here where we all have them, is that where you just work solely on, or do you do the whole face?
Well, in Aideen's case, we actually treated the whole face, but concentrated more in some of the areas where the lines were deeper. Right. So we concentrated under the eyes, which is a real problem area for most people and most women over a certain age. Concentrated on the fold on the cheek, which is called the nasolabial fold.
So just show us again how you do it there. So it's basically just putting
basically putting this probe on the skin.
Yeah, and moving it up.
And moving it up and down.
Right.
Now, I know when I press this, it's going to interfere with your mic, but essentially, basically, that's how easy it is.
Okay.
So you're just using the probe, gently rotating it in a circular motion, and that basically heats up the skin.
And then it's filling out the crease.
Skin is actually tightening in front of your eyes.
Wow. Okay.
It is simple, safe, and
now if Aideen wants to maybe just sit up slightly there, and we'll just show you a before and after shot, and just to see if you at home can notice the difference. But there's we're going to show you before and after. There you go. Well, yeah, there is a difference, isn't there? You look much fresher, even you certainly look fresher. Yeah. With that. Now I know lots of people are going to know how much does it cost.
The full face treatment is it's in the order of €600.
600. It's a lot of money.
Not really, not for what it actually does.
Okay.
This treatment works.
Right.
And that's the beauty of it.
And how long does it last? Will it last like, do you have to get this done like in 2 months' time or 4 months' time again?
The recommendation is to have 2 treatments 6 weeks apart, and then you maintain that result once a year.
All right, so you get 2 treatments and then once a year you go back.
exactly.
All right. And why do you need to get the two treatments so close together?
Just to get the maximum amount of collagen stimulation.
All right. And what about women who may have Botox and fillers already, but they'd sort of still like to go and get this done? Do you do men as well?
I do indeed.
All right. So if I went down to you, you do me a deal?
Absolutely.
But if women have Botox and fillers?
It's perfectly fine. This actually works better when you have Botox and fillers in conjunction with it. Absolutely.
Because I thought you wouldn't be allowed to do stuff like this if you've Botox or fillers.
When I treat my patients, I do this first and then do the Botox after the treatment.
Oh.
So you can actually have both done on the same day.
Do it all. Okay, so it's the clinic is called?
About Face Clinic.
About Face Clinic in the Beacon Clinic, and we all know where that is. And so you can go along. Do you have a website?
We do indeed. It's www.aboutface.ie.
Aboutface.ie if you want to find out all the information about that. Thank you very much for coming in and showing us that. And if you want to find out more information, you can go on to their website. Thank you very much for that.